Oxyhemoglobin dissociating curve. Dissociation curve. Oxyhemoglobin is dissociation curve. And right here, it doesn't
جلسه قبلی خودش اشتباه کرد گفت تا صفحه 33 جلسه قبلی تا صفحه 23
What is it you do? Pressure what? Oxygen, okay, where? Which one?
It's in tissue. No, it's in blood and when it's
Oh, excess sticks. Reflects special pressure of oxygen where? In the external environment or internal environment. Where?
اینو بنویس توش همون که گفتی
Here, hemoglobin or no?
HPO, the percentage of the oxygen in the through the hemoglobin.
What is it?
هموگلوبین اردو
Percentage of what? Percentage of what?
Percentage of oxygen
No.
in
Yes, you
the
mark percentage. What is a percentage? Oxyhemoglobin from what? Percentage from
is
what?
80% of the oxygen in blood.
No.
Is
No.
in HPO2. HPO2.
Not oxygen.
Is in our red blood cell.
No. What is a percentage?
The percentage of
97.
oxygen that bind to the hemoglobin.
Yeah, I said
You have percentage, for example, 90,
97.
96, 97. What is a percentage?
It's in blood. This one unit. This one is.
Professor, it's the percentage in the lung.
بگو
It's 97%
What
because
is a unit? Oxyhemoglobin percentage. Percentage of what?
it's because 2 to 4% of the we get the average it will be 3% in this one in the plasma, so it will be HbO2 97%. Maximum when the
No, this is percentage to hemoglobin concentration. How much hemoglobin concentration is binding to oxygen?
hemoglobin.
Part of hemoglobin occupied by oxygen. You say to oxygen, but not to
No,
oxygen.
I said the amount of oxygen that is in HbO2. I said this.
Not amount of oxygen. Amount of oxygen is another amount of oxygen, about 20.
HB in the
20, how many? What is a normal amount of oxygen saturation in the blood? How many percent of oxygen content? How many
this
percent?
20 milliliter in 100 milliliter blood is
How many percent? Volume percent. How many? Saturation oxygen. Oxygen content.
Is 100 milliliter from blood contains 20 milliliter
Okay.
of O2.
20% above, because it may be more or less, it depends on hemoglobin concentration, because oxygen is transported mostly hemoglobin. So, with this maybe 18, 20, or 20, for example, when hemoglobin content in the blood about 150 milligram per liter. Then normal blood will contain 20% volume percent, because percent of gains is counted in volume percent. Okay, let me explain why oxygen is transported mostly in distilled condition. Mostly without binding condition.
Because of the binds to the lipid lipid for transferring in the
Is it fat soluble? Oxygen is fat soluble. It's soft, bad. So it requires binding to
Water somewhere.
transport system. Transport system here hemoglobin. Oxyhemoglobin dissociation curve. Never in the blood all hemoglobin cannot bind to oxygen, but most of hemoglobin binds to oxygen. When blood goes across lung, there's gas exchange, and partial pressure of oxygen becomes equal partial pressure alveolar. Alveolar is lung circulation, lung circulation. When blood goes across tissues, cells take oxygen, and partial pressure of oxygen in the blood falls to about 40. But here 75 mostly. And due to this S-shaped size, what happens with this curve in response to physical exercise? For example, physical exercise. You have physical exercise. What happens?
It will become this way because when we do physical exercise, the amount of carbon dioxide increases and the H plus increases, so pH decreases, and another
This shifts to the right.
Yes, it will get the blood gets oxygen with more
More or
time,
less?
longer. It takes more time to get enough oxygen, and it releases the oxygen in the tissue.
Not time. It's another mechanism. Why this curve is shifted to the right? When carbon dioxide increases or
The
temperature.
pressure of the auto decreases.
How carbon dioxide affects hemoglobin?
Carbon dioxide also with emitters carbonic bonds to the hemoglobin, and it is more intense to bind to hemoglobin than the oxygen.
More or less?
No, it's more.
Increase affinity or decrease affinity?
Less.
Carbon dioxide as well as high temperature decreases affinity.
pH, right?
Affinity of hemoglobin to oxygen. Affinity.
But in normal situation,
Hemoglobin can bind carbon dioxide and oxygen both. And transfers oxyhemoglobin, carbonyl hemoglobin. Here I mean when more carbon dioxide, it compares with oxygen and decreases affinity of hemoglobin to oxygen. Its capacity to bind to oxygen. So it shifts curve to the right. So it's less capacity. But due to S-shape curve, S-shape of this curve, here no big problem, a little less than in normal condition. For example, 95% in the lungs. It's not crucial, but here hemoglobin can remove more oxygen into tissue, can give more oxygen to tissue, more amount. It's compensation. This effect is evoked by increased partial pressure, carbon dioxide, temperature, and pH, decrease hydrogen plus increase pH decrease. Everything happens during active physical exercise and synthesis of a special substance to free B-phosphoglycerate in erythrocyte. It happens, for example, at high altitude in the mountains. Okay, thank you. Good. the opposite process happens in response to opposite changed shift of variables. Hypocapnia, alkalosis, decrease of temperature. These curves will shift into opposite direction. Transport carbon dioxide. Transport of carbon dioxide. What forms?
یکیشون بهتره. آره این بهتره.
Carbon dioxide is water soluble and it's so better, but anyway, not so much dissolved in blood. Because carbon dioxide is converted quickly. Carb amino, carb amino hemoglobin. Carb amino hemoglobin.
In the membrane of RBC, we have enzyme, not named.
What is it? 75. What is it?
Yes,
Ah.
we have enzyme which is called anhydrous carbonic, and this has binding C2 with H2 and producing H2C.
Carbonic.
C3 that is not
It's not unstable.
not
Not
stable, and this
Hydrogen
Yes.
ion and
and this is blood, and instead of this we have transport of the
Okay.
and more of the CO2 in the form of HCO7 minus HCO3 minus in the blood.
bicarbonate. I can say bicarbonate is easier. What salt of bicarbonate inside the erythrocytes and in the blood? It's anion. What is cation? No, this is
This
what main cation inside cells? Cation.
sodium and
Inside cells.
inside cell.
Sodium.
Calcium.
No, potassium.
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 So we have potassium salt in the blood. Sodium.
Yes.
In Russian it's called soda. Soda. In supermarket. Soda. The same. And, so carbon dioxide can be dissolved, but it's unstable substance, unstable compound, because it interacts quickly by chemical reaction with water. But it's very important. Why erythrocyte red blood cells form, make more acid and the bicarbonate compared to blood plasma? Why this reaction prevails inside?
Because of the presence of enzymes anhydrous carbon in the membrane of the RBC.
Carbon anhydrase. Very good, because the same will be in the kidney, in the
Yes,
back.
and the kidney.
Okay, thank you. It's main about carbon dioxide. Next, Mr. Doctor, questions, I don't remember. Like what more? It's not difficult. Next question.
آره اینجا هنوز اونقدر بازش نکرده دیگه میریم جلوتر اصلا تو اینم مکانیسم ریسترشون
Так, окей. Значит, next part, значит, we are going to talk about breathing control of breathing, external respiration. Mostly control of first stage of respiration, lung ventilation. Of course, the body controls other parts also due to control of perfusion, mostly with local but systemic mechanisms. Also, control of breathing control and lung perfusion is coordinated with the control of cardiovascular system. But now we are going to talk first about just breathing control. What type of regulation prevails, nervous or humoral? Nervous. Humoral is possible, but indirectly, by a
Something happens to the landings behind those. Yeah.
local regulation of blood perfusion, and bronchioles diameter. Humoral regulation may be, for example, epinephrine. Humoral influence on breathing center, or local control of perfusion, another local control of perfusion. How to define main center? Main center, crucial for breathing control. Does the inspiratory muscle diaphragm have automaticity?
No, it doesn't.
So it must have signal from motor neuron.
Yes.
Do these motor neurons have automaticity?
No.
No.
So they must receive signal from
Centers. Yes.
Spinal center or brain center. How to investigate?
Professor, it's mainly located in medulla, right?
Medulla,
It's,
first I will explain experiment, then ask you again.
okay.
Actually, breathing control, breathing center, connections between neuron chains inside the breathing center, very complicated, is unclear fully in the modern science, but we studied the just simple processes, the principle, concept. Brainstem, including pons, very important here, pons, medulla.
Medulla, the spinal cord.
Then spinal cord,
Cervical and thoracic.
cervical and thoracic.
Thoracic.
What part of central nervous system contains motor neurons innervating diaphragm? Cervical. About C4. C4 framing neuron. Innervates diaphragm. When diaphragm contracts, it makes chest wall bigger. Then it decreases intrapleural pressure, increases transmural pressure, and stretches lungs, and air moves into lungs. This is the main inspiratory muscle. Where a motor neuron innervating intercostal.
Thoracic. Thoracic.
Well, Okay, normal breathing. Normal breathing. Pneumography. Значит, normal breathing. Inspiration, expiration. Usually inhalation a little shorter than exhalation. Normal breathing. But no, it's not so important, so just 1 to 1. Значит, normal. What happens with normal breathing if you transect spinal cord at the upper?
It will stop. It will stop.
So, conclusion. The main breathing center is located in the brain.
Yes, in the brain.
If you transect in healthy animal spinal cord between cervical and thoracic,
It will be like a little bit, like the amplitude will be smaller. Decreases. It will decrease. It will
the
decrease.
breathing rate doesn't change, but it is different amplitude.
Yes.
Volumes. Okay, next transection. If you transect brainstem upper medulla between medulla and pons, what happens?
It's slow. Inspiration and expiration.
Actually, there is a pause between expiration and inspiration. It evokes breathing like gasping. Not regular breathing, gasping.
So expiration will take longer time, right?
It delays inspiration. Inspiration is shorter because the interaction inside breathing center here, respiratory center, and then again pause, big pause. If you transect pons approximately at middle, it will again change, decrease breathing rate with longer what? Inhalation or exhalation?
Inhalation.
Inhalation becomes longer, then
It's shorter. Yeah.
like this. Sometimes it's called apnea. Maybe so. Apnea. No different scheme. Depends on places. So, main center located medulla. Without it, it's impossible to breathe. But a normal breathing pattern is established due to involvement of pons center. And pons contain at least 2 centers,
Yes.
with different function influencing on medulla. What it's made. What is a normal breathing rate? Normal breathing rate is about
10 to 20
20 per minute.
20.
Yes.
10 to 20.
10 is sportsman. 16, 20. But 10 is possible to 8, 10 is possible in sportsmen adapted to regular physical exercises. Count now breathing rate in your newborn, your classmate. It's better to count it, putting your hand here, take a clock, and count each other.
We have to count for 1 minute.
Relax. 1 minute.
اه
1 minute.
طب الشكل طبيعي.
And compare.
انا مش حاسس بشيء. Professor, 17. 17. 17.
Okay. Who has less than 16? Less than 16. Who has? Or more than 20?
No one? So, Professor, between 16 and 20 is the normal, right? So,
No, at rest.
yeah. So, if at rest, if it's like 15 or 14,
About 16. But it depends, little depends, maybe depends on, how to say, size. Yes, big person has less frequency.
oh.
More rarely. Small person, 22. Why? Stress? Actually, a small person can have more breathing rate because smaller person has more heat exchange, so it must have more higher metabolism. Higher metabolism requires higher heartbeat and breathing rate. Heart rate and breathing rate. But anyway, it's like this, about it. Так, well, if you transect brain afterwards,
It will be normal. Normal.
normal, but of course, if the sleeping animal with anesthesia, so for normal pattern, at rest, it's enough to have brain stem to control breathing. But if you have behavior, of course, higher centers influence to bones and medulla during behavior to adapt behavior, limbic system, cortex, limbic system.
Cortex,
System, hypothalamus,
hypothalamus, and
cortex,
then cortex.
cortex. What do you think? Motor neuron provides innervation of diaphragm. Do they have direct command from primary motor cortex?
No.
Yes.
Corticospinal tract also innervates primary motor cortex. Innervates motor neuron. So you can have voluntary change of breathing to do more or less, and the diaphragm contain different motor units, slow motor units as well as fast motor units. So you can change volume, breathing volume, respiratory volume, and the breathing rate equally. What about breathing respiratory center? Respiratory center, main respiratory center,
VRG and VRG. Lateral.
is next. Honey. Say shortly about function of DRG and ERG. What is a function?
DRG, it is for the inspiration and expiration.
DRG.
DRG, it is for the inspiration.
Why do you think so? Yes, but why?
Because it is for the
At first, say about principal types of neurons inside within respiratory center. The neurons can be divided at first to two big types. Types of neurons. What are the types of neurons? In accordance with the phases of breathing.
inspiration and expiration.
Name of neurons. Okay.
The expiratory and
Expiratory and
expiratory and
expiratory.
expiratory.
we have two principal groups. Right? These groups may be divided to subgroups, but principal group inspiratory neurons, expiratory neurons. Right? Why are they called inspiratory, expiratory? Why?
Because it is for the inspiration and the second one is for the expiration.
What happens during inspiration with inspiratory neurons?
Because it is for the
As we know,
it is for the beginning of the start process, and because of that it is called the inspiration.
yes, it's function, but what happens with neurons? Inspiration, expiration. In politics. Draw the scheme of action potentials, time of action potential, in inspiratory neurons and expiratory neurons. Fire. Action potentials, where? Simple scheme. With time of action potential.
It is for some action potential.
No, action potential, you have lines. Draw where? Inspiratory neurons fire just at the end.
نه اون اکسپیریشن
Inspiration.
از اول نمودار میگم از اول نمودار شروع. از اول نمودار.
Before inspiration.
نه درسته اونجا میخواد بکشه.
Professor, it's during the inspiration,
During
right?
inspiration.
During.
از اول نمودار هانیه از اول نمودار تا قلده اینسپیریشن
اینجا professor it is for here and
You
here.
didn't draw. Okay. Put the problem here.
يا بنتي
خودش
ده
گفت پایین.
پایین از
It
اول
was a thing, but not correct
اطلع صعب.
time.
لا لا سيبها سيبها
همین خطی رو از اول نمودار پایین بکش تا وسط
And اینجا
هانیه
استاد
همین دیگه
Three phases. Start inspiration, finish inspiration, finish expiration. One more, zone three. Where inspiratory neurons are.
from here professor
Yes.
and
خب بکش
يا بنت ايوه كده الله ينور
همین رو پایین بکش
And now about expiration.
این
Where?
بر این بر
بابا اکسپیریشن
بکش تا ته نمودار ته نمودار بالا
Okay, now understand.
No,
What
yes.
is but it's simple classification. Later I will explain more details.
We have subgroups, right?
Subgroups, but here now is simple classification. Okay. So the inspiratory, expiratory neurons, two groups. And some groups intermediate. Then, how dorsal respiratory group, dorsal respiratory group influence on neurons. Inspiratory or expiratory?
I think it is for the
Dorsal
inspiratory. It is for the inspiratory.
Inspiratory neurons. Значит, dorsal respiratory group neurons innervates mostly or only, it's not unclear, mostly inspiratory neurons. What about ventral respiratory group?
It is both of them, inspiratory and expiratory.
It's a dorsal or ventral respiratory group actually consists of four parts. Two parts innervates expiratory neurons, expiratory muscle motor neurons, and another part innervates expiratory, inspiratory. Let's draw. Значит, dorsal respiratory group innervates this. Ventral one part innervates this. It's inspiratory parts of ventral respiratory group. Another part, example here, will innervate expiratory. Expiratory motor neurons innervating expiratory muscle, providing active exhalation. For example, internal intercostals. Internal intercostal muscle, expiratory muscle. So dorsal respiratory group innervates only inspiratory neurons, inspiratory motor neurons innervating inspiratory muscle. Inspiratory, black, yeah. Ventral respiratory group has several parts, 4 parts, 2 parts innervates, providing inspiration, 1 part of them innervates directly motor neuron of diaphragm and external intercostals, and other part innervates motor neuron innervating expiratory muscle.
Professor, what you wrote there?
Internal
Subs?
intercostal muscle.
Subs?
Yes,
Internal intercostal muscle.
Expiratory, internal intercostal.
Professor, I'm sorry, can you explain it again? Can you explain it again, please?
Green?
Both of them, yes.
Значит, dorsal respiratory group innervates only motor neuron innervating diaphragm and external intercostal, то есть inspiratory muscle. Dorsal respiratory group innervates motor neuron innervating inspiratory muscle. Inspiratory muscle. Diaphragm and intercostal, I will not repeat again. Ventral respiratory group. I didn't explain in lecture because it's so much for dental student. But
Yes,
it's interesting to
lecture.
understand. Ventral respiratory group has several parts. 1 part expiratory, another part inspiratory. And еще 2 parts pacemaker zone. It's complicated. Understand? Pacemaker. Pacemaker zone activate inspiratory neurons again. Innervates motor neurons. Motor neurons innervates here. Motor neurons and expiratory part innervates motor neurons innervating expiratory muscle. It provides, this part provides active expiration, active exhalation. During quiet breathing, it's enough to coordinate excitation and inhibition of inspiratory neurons because expiration is passive.
Thank you, Professor.
A respiratory center has several parts of neuron. Inspiratory neurons may be subgroups. Early inspiratory neurons activating the
At the beginning and late. We have late.
late at the end.
At the end.
At the end, late. Inspiratory neurons activated all time. Expiratory neurons activated all time. And pre-inspiratory neurons activated before.
Before inspiration, before.
Inspiration,
Yes.
shortly. Is actually between and previous phase and
Yes.
new and
Post inspiration. Yes, when they to switching.
Yes, post inspiratory neurons. Post inspiratory neurons, post inspiratory. This is model of 90th years of previous century, but it's more or less okay. Modern models are more complicated, but the idea is the same. The respiratory center contains a subgroup of neurons connecting innervating each other with excitatory or inhibitory conventions to provide a pattern. Pattern means start inspiration. First we must start inspiration, trigger inspiration. Then continuous inspiration, next step. First start, then continue, then switch inspiration to expiration, and then again start, provide expiration, and then start next. It's actually four processes. Quiet breathing, so expiration is passive, it requires just inhibition of inspiratory neurons. So expiratory neurons must inhibit inspiratory.
Yes.
Let's draw scheme of simple scheme that I showed in my presentation of.
Can I try? Oh.
Listen.
Oh, okay.
Clean here, so that this was clean.
Professor, next week will be the color?
Yes. But I will not everybody present at least one. I will not ask for small control work before, because we don't have a lot of time. Anyway, you must have at least one positive mark. One positive mark to be a load or column. One positive.
Professor, it will be test and oral part or just oral?
Test.
Test.
Test and oral. As usual. Anyway, oral question about clot, hemostasis. Hemostasis, leukocytes, because it's more important fact for medicine. Blood clot types, hemostasis, leukocytes.
الله على عيني كنت الحمد لله دروسي وحياة ربنا.
Respiratory center has automaticity because it has special zone, and now it's called named Pre-Bötzinger complex. It contains pacemakers cells, pacemaker cells.
Because they have automaticity also, right?
Automaticity, it has automaticity, but automaticity is very, very slow. And so respiratory center must have signal, must receive signal, stimulatory signal from different receptors. A lot of receptors influence breathing. And we can divide these receptors to specific receptors located in the respiratory system and non-specific receptors. Specific receptors respond to gases and activity of respiratory system organs.
تنسيتين مش عارف ايه تنسيتين تعالي على ايه يعني جماعة الشهود بالعمر شاطرين زيك خلينا
Where is the main
نفس بالا نمیمد من هی گفتم که چی خیلی
In a cerebral state, the spinal fluid
No.
and
The center cannot be located inside fluid. Location of chemoreceptor where?
Professor. Can I say it? It's located in central.
Where?
المدلة.
This center has
In the lateral.
Yes.
chemoreceptor zones, sensing directly gas composition of cerebrospinal fluid,
Yes.
but not all gases. Breathing, respiration maintains, controls concentration of oxygen as well as carbon dioxide. But only one of these cases is made in principle in breathing control. What is?
The CO2.
Oxygen,
The
carbon
carbon
dioxide.
dioxide.
Carbon dioxide. Because increase of carbon dioxide stops oxidization reaction. Anyway, if you have a lot of oxygen but at the same time a lot of carbon dioxide, oxidation process will be stopped. You do a lot of product of this reaction. So it's more important to control carbon dioxide at first. And explain how does it work.
When the pH is decreased in the cerebrospinal fluid in the chemoreceptor, it's excited the chemoreceptors and then it grows.
Yes, and the carbon dioxide doesn't affect directly, it decreases pH.
نه پایه درست
بالایی آره اونو مثبت کن اونم نه اونم منفی کن
No.
منفی اونم وسط
میشه اینا
Inhibitory.
Inhibitory.
How does it do this? Inhibits.
باید منفی باشه منفی باشه
Negative is just.
اولی مثبت دوم منفی
نه ببین
منفی مثبت
يلا شوفونا الفاضية.
في منفي يعني سالب
Must inhibits.
اونجایی که دست گذاشت منفیه
وممكن لو
Inhibitory neuron. Inhibits. If excites.
اونجا مثبته درسته مثبت
No, here excites. Excites, inhibits.
I want to say it and then I can
Yes, it was understood. The first signal, more important signal, providing normal breathing pattern, it's increase of carbon dioxide. At first in the blood, and carbon dioxide goes easier across brain-blood barrier, blood-brain barrier, and connected in cerebrospinal fluid. It provides more hydrogen ion, like erythrocyte, the same. pH decreases. Does pH of blood influence on pH cerebrospinal fluid? Can pH of blood influence pH within cerebrospinal fluid? Carbon dioxide on blood. Carbon dioxide can go.
go and
What about hydrogen ion from blood?
H3 HCO7 carbonate.
Hydrogen ion, like carbon dioxide, goes into cerebrospinal fluid from blood.
No.
Very good.
But
Just carbon
this one
dioxide.
is the bicarbonate of the blood. We have the
It's result. It's result, okay? But it doesn't influence on cerebrospinal fluid. Just pure carbon dioxide. Carbon dioxide this goes across blood-brain barrier and increase carbon dioxide inside cerebrospinal fluid. It increases hydrogen ion. Hydrogen ion stimulates central chemoreceptors.
and then chemoreceptors is early respiratory technique.
Respiratory neurons.
Yes, it stimulates early respiratory neurons and then it stimulates inspiratory neurons and inspiratory neurons amplified respiratory and then stimulates or excited muscle of the inspiratory
Muscle, yes.
yes,
Respiratory
and
muscles.
yes.
Respiratory muscles. This is respiratory neurons transmitting signal from a higher level of higher networks directly to motor neurons. Their work, just transmission of signals. With this level, decision what to do, inhale or exhale. Full inspiratory neuron transmits the information. During inspiration, inspiratory neurons inhibits No, inhibits, no, it's not positive.
No, not inhibit. It's not. It doesn't happen.
Yeah, it's not inhibit. What happens with expired?
First, early inspiratory neurons stimulates latent inspiratory that inhibit meconic. Inhibitory neuron, then early inspiratory neuron, late inspiratory neuron.
It's an interaction between inspirator and expirator.
And then
It's an interaction between inspiratory and expiratory neurons.
It's inhibited.
Inhibitory interaction. What is the name of interaction when one center, here inspiratory, inhibits antagonistic center? Name. What is the name of this interaction from previous semester?
Name of
Principle.
Ah,
This principle of coordination.
integration.
No. You said it in the lecture.
Reciprocal.
Reciprocal.
Reciprocal inhibition. Inspiratory center inhibits expiratory center. And opposite. Expiratory center inhibits inspiratory. Now you can see how does it happen. This early inspiratory neurons inhibits expiratory. And at the same time, like recurrent inhibition, but more complicated, the chain, like recurrent inhibition, with time, early inspiratory neurons becomes inhibited. It decreases inhibition of expiratory neuron, and expiratory neuron becomes more active. But when expiratory neurons active a little, their function just inhibition of inspiratory center. To have forced expiration, expiratory neuron must have signal from
The brain.
higher centers. No, from pons, cortex, everything. Pneumotaxic center. Stimulating. No, depends on, because forced breathing is related to emotions or voluntary. So everything can innervate directly expiratory neurons or across pons, mostly across pons. Indirectly. Well, next. Next functions of acoustic center, pneumotaxic center. Seven.
Yes.
Function of acoustic center, pneumotaxic. If you can draw here, I didn't show it actually, but you can draw.
For agnostic, I know that for switching expiration to inspiration.
How can we do? Acoustic center, pneumotaxic. By arrow, show influence of acoustic center to which part? Here and pneumotaxic.
Switch expiration into the inspiration. So it will be the activation of the inspiratory, so early inspiratory.
Here and plus.
Yes. And here it will be the inspiration to the expiration. So it will be the expiration.
And stimulation of this, it inhibits this.
Yes.
No, inhibitory neuron what happened? Inhibitory neuron here. Just inhibition of inspiratory and pneumotaxic center inhibits acoustic. Similar red nucleus inhibits regulators nucleus. With higher control inhibits lower red. Pneumotaxic center helps to switch inspiration to expiration. So if you dissect pons to separate pneumotaxic center, draw here position, location of pneumotaxic and acoustic.
In the first will be pregnancy, and second it will be the
Pneumataxic must be higher transaction.
They look at the end of points.
Okay. And the short here influence pneumataxic practice.
I think we will have
No, so after transaction, we deleted the pneumataxic center influence, and inspiration becomes long lasting, and then shorter expiration. Do you understand? Well, thank you. You can sit. Next. Before chemoreceptor, I want to explain a little about your normal time of inspiration and expiration. You can measure it in human by another method. We didn't discuss about it before, pneumography. Sometimes it's useful for dental patients because the oral cavity is part respiratory airways, and breathing control is connected with control of chewing, speaking. It must be together. There's pneumography. Pneumography method is based on mechanical transduction, chest excursion, chest movement. Under skin, and above skin, above clothes, it's not important. Tape with mechanical transducer. It responds to movement of chest wall, and converts its electrical impulse and curve. Inspiration, expiration. It's about a ratio like 1 to 1.3 at rest. It's not volume, it's the movement of your chest wall. What happens during speech? What is occurring? Short.
Would be shorter.
More expiration, because you are speaking during exhalation.
Yes.
Expiration. Short and deep inspiration and long expiration. This short stops means words.
Yes.
More words, letters, sounds. This ratio may be 1 to 6, for example. It depends on speaking practice, vital capacity. What happens during chewing? And compared with rest. During chewing, expiration becomes
Longer?
less deep, more superficial, maybe so, not ordered, and with delay during swelling. And when we did this experiment with student to record thermography, this curve shows before stop breathing, small expiration, sub expiration, and then holding breathing during swelling. And then again, inspiration. Here swelling. During chewing, breathing becomes less deep. Less deep. About speech. Speech. Speech, what is a speech? Speech has two mechanisms, very important mechanism. Phonation and articulation. It's very important for you because speech may be changed after your treatment, prosthesis, or another treatment. Speech, phonation, articulation. Phonation uses vocal cords, voice, due to vocal cords. Can you say words without phonation?
No.
Yes.
Okay.
Yeah,
Okay.
you
Okay. Yes.
have,
Yes.
but it's of course not loaded, very silent, but you can.
Yes.
Due to articulation. Articulation uses resonance system. Resonance means passing air across cavities. What cavities? Nose, nasal cavity, oral cavity, pharynx, and respiratory, all respiratory airways as cavities. Resonance due to cavities. And you have voluntarily change size and shape of some cavities, for example, oral cavities, by moving of your tongue, active contraction of mimic muscles. So this has two mechanisms, active and passive. Passive, for example, nasal cavity. Nasal cavity doesn't change form and shape in a healthy person. But sometimes it may be changed due to flu and I forgot the English transport. For example, so pronunciation. Or when you have a problem with pharynx,
Yes.
infections. Active and passive. Active forms phonemes. Phonema is unit of speech. When child starts to speak, first sounds in childs of each nation are similar. And at about ninth months, sounds becomes more similar to native language. But until ninth month, all sounds in all childs are similar. All native, all nations. Similar. Then the details. How can you influence on speech with your treatment? You can change volume of cavities, oral cavity due to your treatment. Prosthesis, global
Filling.
Feeling, yes. Feelings, volume, feeling size. You can change volume, and it can change articulation. Articulation. Speech is behavior. Speech, behavior. Behavior. Is it is controlled by autonomic or somatic?
What?
Somatic nervous system, somatic. Autonomic can help with salivary salivation or salivation during speaking, or regulation of diameter of respiratory airways, but mostly it's somatic system. Behavior. Behavior has motivation. Motivation. Motivation use memory. It's system from previous semester, higher nervous activity. Afferentation, information about environment. Sensory information. Sensory information. Sensory information not about only about external environment. It's information from oral cavity also. It's very important because it influences on speech production. If a person has something uncomfort in the oral cavity, maybe it will inhibit his wish to speak. Then decision to speak, make decision. Then model of speech. Model and program. Program of speaking.
Processing.
Program of speaking. Then speaking.
It's previous semester, right?
Yes. Speaking. Between program and speaking, we have effectors, respiratory system, because we don't have special organs for speaking. Body uses respiratory system. Respiratory system and additional organs, mimic muscle, tongue, respiratory system, and some organs of digestive system. In change of microcirculation oral cavity, which is speaking. Speaking has a result, words, sentences, and then brain compares it with model. And for example, if a person doesn't have front teeth, he can change pronunciation.
Yes.
From famous Russian. Especially some consonants requires frontal teeth, and it may happen after your treatment also. And the person hears and compares words with model. If he has mismatch, not correct pronunciation, he tries to correct. During correction, new afferentation from artificial tools, new afferentation, change program. It requires time, maybe some days, maybe a week, depends on area. And so some person may be adapted in months. It's normal. It depends on age or personality, personal activity in the nervous system, more excitable, less excitable. But anyway, it may happen, and you can say, you can tell patients that maybe you will have problem with speech first time, but with time you will adapt it, and new information will be revealed in program of your brain. Well, it's enough about this. Next, receptors. Specific receptors may be divided to due to specificity, chemoreceptors, mechanoreceptors, and how to say, polyreceptors. A receptor with responding to chemical signal as well as mechanical signal. More important in regulation of breathing control, chemoreceptors, specific chemoreceptors. About specific receptor, specific chemoreceptors. We talked about before about central chemoreceptors. Central chemoreceptors are more sensitive. What is another group of receptors? Here you can.
Professor, what is the question? What is the question?
About chemoreceptors, specific chemoreceptors. We are going to talk about chemoreceptors. We have central chemoreceptors. Central we discussed before, located in the middle. They are marked here by chemoreceptors. Near respiratory center, medulla respiratory center. Peripheral and draw location of peripheral receptors. Draw, like baroreceptors, the same.
How
zone.
metabolism?
It's heart, aortic arc,
Cortical sinus.
No, draw the scheme of aortic arch, heart,
ببین
خوش
قلب
خوش
One of them is here.
what is it? Aortic.
No, carotid.
Aortic arch. Where? Like
قلب بهش نگاه همون توی که من بهشون
I will draw heart and you will draw position of the center. Heart,
بعد یه
aortic.
قوس بده که اون قوس میشه
Carotid.
خب خودش
One of them is here.
یکیش هم تو قوسه
As a receptor, primary or secondary? Primary or secondary?
Secondary.
Secondary. Secondary, so what does it mean? Secondary. Previous semester.
Yes.
Secondary. What does it mean?
Theta. Secondary.
اصلا یادم نیست
I still have all the notes. I will revise it from previous semester.
Primary receptor are the part of nerve ending. Secondary special cells with synapse, having synapse with nerve ending. So there we must have synapse and
میدونی
nerve ending.
نه همون جدولی که پارسال کشیده بودیم واسه گوش و اینا بعد نوشیم سکندری رسپتور آره حساب
The same parameters, the same.
One of them is
با شما حرف بزن
Okay.
Sure.
What signal mostly? What signal more? To what signal they more sensitive to? What signal? What signal there are more sensitive to? What signal stimulates? It's stimulus. Factor inside.
Increasing of the CO2
At first, increasing carbon dioxide, the main.
and another one is will be the decreasing of O2 minus 60%.
Pressure.
Pressure, hemoglobin will be the 19%. And the pH and the pH it will be the decreasing.
کربن دی اکسید هم
What is the normal partial pressure oxygen in the blood, arterial blood? 100. Here less than 60, just so much, decrease. During your usual breathing, it doesn't happen. When it happens? in normal life. It may be happen when you are climbing at altitude 2,500 meters and or more.
Yes.
At least this is 2,500 meter above sea level. Above sea level. Mountain. Above sea level. Well, they have carbon dioxide is made, secondary pH, and less sensitive,
Yes.
less sensitivity to hypoxemia. And this reflex, what reflex prevails from central receptors or peripheral receptors? Central.
Central.
Peripheral receptors helps, mostly during physical exercise, and they don't have a lot of influence during normal activities. Okay. Now, next. The mechanoreceptor, providing Hering-Breyer reflex. William. Mechanoreceptor. Explain. By the way, what do you think? Where is the secondary other neuron? Secondary other neuron reflex from peripheral chemoreceptor. What do you think? Where secondary other neuron reflex?
And شو كان اسمه؟
Medulla,
In the same zone.
what nucleus?
وين كاتبوها؟
Preganglion.
What is not ganglion, nucleus? Medulla.
كاروتيد سينوس؟
No, it was
What nucleus in medulla?
دورسال.
Dorsal, okay, but after, before dorsal perspective.
Salutarius.
Yes, nucleus tractus.
What is it name?
Nucleus tractus
I
solitarius.
said okay.
Famous nucleus.
Yes.
In chewing, in cardiovascular system, and Really about pulmonary stretching centers. Pulmonary stretching centers. Slowly adapting. Our pure, what does it mean? What is afferent nerve? Vagus, okay. Where are they located? What part of respiratory areas? What tissue? What tissue of respiratory areas? Alveolus or bronchi? Bronchi, bronchioles, what layer? Endothelium or smooth muscle? Smooth muscle, because they are mechanoreceptors. Smooth muscles, and they increase firing in response to stretching during inspiration. This reflex doesn't work a lot during normal breathing, but it works more when you breathe deeper. When your tidal volume more than 1 liter, usually half liter, 1 liter during physical exercise. What is a Hering-Breyer reflex? Hering-Breyer reflex.
شو؟
Reflex, Hering-Breyer. Reflex from the receptors. Hering-Breyer. Reflex. Function. Okay, function of the receptors. No, what does they do? When the receptor fire, and what does they do with breathing? What is the reflex? Describe by words. What does they do?
When they fire, because they inhibit the expiratory and start inspiration. It causes inhalation.
This reflex increase inhalation or exhalation?
Increases inhalation.
No.
Acceleration.
This reflex stops. It helps to switch inspiration to expiration. Switch inhalation to exhalation. Because you are stretch lungs, it helps to switch. If you transect valves, nerve, what happens with breathing? What happens with breathing? After transection, vagi, cut. Transection, cutting, vagi. What happens with normal breathing? Here, no. Draw here. What do you think?
سواء الحرارة
Acceleration.
This is normal. And draw here what will be happen after.
I think this one will be long.
No.
Long acceleration.
No. No. Open. Must be open.
So inhalation will be long.
What about dips? The same?
No, it will be
More or less?
less.
No, more. If you put, if you pay attention first slide about transection, you can see the two cases. Transection on the brain stem and transection of brain stem together with vagus transection. And you like this longer inhalation. So breathing becomes dead and slower. Next type of receptor. Next type of a specific receptor are responsible for defensive reactions. Amar. Irritant receptors.
Okay.
Where are they located? What are their functions? Irritant receptors. Right.
معلم
They are located in the epithelium of respiratory tract. They are not that too much significant.
في العادي
Depends on
في العادي في الوضع العادي
normal, no, but
Yes, normally yes. But for example,
حساسين
they provide
للمواد
defense
الكيميائية.
response. What signal stimulates irritant receptors? What signals? What factors stimulate? What stimuli? Excite irritant receptors.
معلم الدخان
like gases, dust,
لا
smoking.
Smoking, dust, toxic gases from external environment, maybe sound.
Yes.
And what is the reflex response?
There's coughing, for example.
Cough.
Cough.
What about depth of breathing? It becomes more deep or less deep?
ولا أقول لك
Deep. No, except no. It will be shallow, superficial breathing. If you will breathe deep, you will pass dust deeper.
Yes.
It's not correct.
Ah,
This is to
okay.
prevent.
بخليها سريعة مع دقيقة مثلا
Not deep.
For example, not
دقيقة مع
should not be, for example, like this. Or
دقيقة أعتقد
Because we doesn't have this receptor in the
ما يسمعوش بنتو
alveoli.
No. This receptor are located mostly in the
Upper
first
part.
part of lower respiratory airway.
والله مش
Large
اسمها
bronchi. Large bronchi.
مش اسمها.
And this reflex, very important, provides constriction of airways. It increases resistance, decreases ventilation. To compensate with ventilation, breathing control, chemoreceptor breathing control increases breathing rate, but breathing depth decreases. More rate, less depth. Tachypnoea. It's called tachypnoea. Tachypnoea. Frequent breathing, but shallow. To prevent passing of bad substances inside lung, or cough, ejection. What chemical stimuli excite this receptor? Chemical stimuli from outside, from the external, internal environment. As you said about stimuli from external. What stimuli from internal environment can stimulate, excite?
We have some substances like histamine and prostaglandin.
Yes, okay. Time already is over. Thank you. But I didn't have time a lot about it. Значит, ладно. The student I asked you how. Значит, actually I don't have one to mark down. I must ask at least that Melika doesn't have any, mark and beta. I need to ask quickly. Beta. Tell us quickly about juxtacapillary receptors. What's
They
the-
have unrelated C fibers and inject by vascular congestion and edema, like edema, and some substances like that causes inflammatory, like histamine and
Where are they located?
and they are located in the epithelial layer of the
Epithelium? No.
epithelial layer of the abdominal airways.
They're located in interstitium near capillaries, not epithelia. Epithelia contains irritant receptors. То есть epithelia irritant receptors, smooth muscle pulmonary stretch receptors, and the alveolar interstitium near capillaries. Therefore, juxtacapillary receptors. So similar irritant receptors, but more deeper, located deeper. And they provide the same response except cough. For example, if you have cough, if you have cough, temperature, fever. With time, your cough becomes less, but your condition worse. What does it mean? Because you have cough, infections. You treat yourself third day your temperature doesn't fever, body temperature doesn't decrease, you have fever, your condition is worse, but your cough is less. What does it mean?
If bronchial don't have irritants, yes?
Yes. So it means infections goes deeper. Deeper. Mucose clean upper part, but infection is propagated deeper. It's bad. It's bad symptoms. It's better to have cough. It means fighting. Means fighting. Cough may be stimulated also only by mucose. Mucose during bronchitis. And pay attention that irritant receptor responds to fast change of lungs volume. So when you have cough, this stimulus affect again irritant receptors. How to block cough? To inhibit voluntarily. If your patient and stop, with time your cough will decrease. If you start it again, impossible to stop, because when you have cough, this rapid change of respiratory airways again stimulate these receptors. Study at home before colloquium from this class, respiration at high altitude, using the now. Influence of autonomic nervous system, to respiratory airways, sympathetic, parasympathetic, dilation or constriction. And information from today.
Professor, is it important for
Not picture. Don't the picture just a little to show.
It's reflex.
It's local reflex. Local reflex and central nervous system, afferent fibers, of course, values. Homework. Homework to make at home, at rest, in the weekend or in the morning if you have time, in the evening. Breath holding test. Homework. Breath holding test. Breath holding test. It's better to do 3 times, one by one, with some pause between them. Breath holding test. During inspiration or first test, and second during expiration. What does it mean? You are doing 2 deep circles. Then deepest inspiration and stop breathing. Stop breathing at fixed time.
Normal for how many seconds?
Count down how many seconds can you breathe, hold your breathing.
And the normal how many?
During inspiration, then normal breathing, repeat 3 times, calculate medium, and then repeat the same during deepest expiration. So full expiration and repeat this. So do it until colloquium, and during colloquium we compare your result.
Okay.
Sitting or lying.
Okay.